Hi, my name is Lonnie Nelson. I'm Eastern Band Cherokee and clinical psychologist by training.
My name is Annette Brown. I'm the Assistant Director of Health and Human Services for the Salt River Pima Maricopa Indian Community.
Hi, I'm Cynthia West. I'm a member of the Wyandotte Nation, and I work with MedStar Healthcare Research in Phoenix, Arizona field office.
Okay, I'm Linda Poolaw. I'm from Anadarko, Oklahoma. I'm in Enola, Delaware. And my mother was Delaware, and my dad was Kiowa.
My name is Bert Dillabaugh from the Cheyenne River Sioux Tribe.
If you are uncertain what the best course of action is in a given situation, it helps to have some data to go off of. And of course, you get data by doing research. It also can help with identifying areas where intervention is needed. So epidemiology, for instance, tells you what the likelihood of encountering a person with a given condition is in a given community and indicates the degree of need in that community for interventions that address that condition. So I think that's probably my best answer as to why research is important. Guides decision making and ideally individual behaviors as well.
Research is important in order to collect data and information to be able to make informed decisions about either how resources are going to be allocated, which issues or problems are going to be prioritized. In order to really have good information to share with community members as to actual causes, we need the data, and we can't just go by stories alone.
And what research does is just basically check against reality so that we actually see what's causing whatever health concerns are going on. And then we can actually do real things to help abate or change those kinds of things that are happening. So I think research is very important so that we are solving real problems with real tools and not just guessing.
I think research is important, especially as far as genetics is concerned, obviously, because it's a chance to figure out problems that are related specifically to Indians and try to target some sort of intervention or preventable measures to help Indians and to try to eradicate some of these diseases.
Research, I think, with the American Indian or the Native American is important because it seems like, especially with diabetes, heart disease, those kinds of illnesses is rapidly growing. I've seen in my communities people dying very rapidly, and they don't seem to be living a really, really good life after losing our culture, and that's partly due to the deaths of and the people getting sick and sicker and sicker and sicker. And with research, we're able to find out maybe the causes, but I think more importantly right now is the medicines, the things that we can help them with, maybe to live a longer and a better life.
A lot of promises have been made to Native communities, and a lot of promises were never kept. So there's a real lack of integrity when it comes to promises made to Native communities. So what's important to make a good partnership is that there's a lot of integrity involved in that partnership, which means following up and doing what you say you're going to do. Make sure that you follow up and that you provide feedback, outcomes and results of research, studies. Give the community an opportunity to review any publications that you're planning on putting out into the public. that's what's going to make a good partnership, is that there's a relationship developed that's based on integrity, that's based on open communication, and making sure that you're willing to take the time to listen and get to know the people of the community.
You know, considering what makes a good partnership, it's really that mutual understanding and mutual trust that both parties will keep their part of the bargain, so that we can move the benefits of that research forward as quickly as possible. And sometimes that's difficult because it takes patience. The problem with research is it doesn't happen in a nanosecond. It takes time and it takes repetition, because you have to replicate studies in order to get reliable data. And we all want answers quickly these days, but real answers come from methodical, really hardworking people who are just trying to get real answers to real questions that benefit our communities.
What makes a good partnership? I think transparency is the number one thing that makes a good partnership. Clear, open lines of communication, and not feeling like there's anything that cannot be shared between those in the partnership. And then holding to one's commitments, I think, is the second dimension that makes a good partnership. You simply say what you're going to do, and then you do what you said you were going to do, and do it in a transparent manner with the best of intentions, and adjust as needed, as the situation demands, and it's a relationship, so you need to treat it like one.